So we'll first of all look at the anxiety disorders, and then we'll follow it up by obsessive compulsive disorder and post-traumatic stress disorder. Now, just a quick note, we don't even really need to mention the DSM-4 because we're on the DSM-5, but obsessive compulsive disorder and post-traumatic stress syndrome used to be listed as anxiety disorders. Now they're given their own category. So the anxiety disorders, many of you are familiar with, they're very common these days, is first of all, the generalized anxiety disorder, which is a state of continual stress and worry. These are people that their sympathetic nervous system, or the autonomic nervous system, is always triggered, and often there's no real reason why. Panic disorder, a panic attack, is something that most people have probably had one, but there are people that get them. They're unpredictable. They come on, and they usually minute-long episodes of intense dread, fear, often heart or chest pain. These people often believe they are dying as they go through a panic attack, which can lead to other problems of being totally avoidant of situations that may cause it. Phobias are those things that go beyond fear, where they interfere with our lives. It's normal to be afraid of a spider, many people are, but it's abnormal to not leave your bed until somebody comes and fumigates your entire room and sweeps it out to make sure there are no spiders there. When we look at generalized anxiety, 2/3 of the people diagnosed are women. Okay, and again, it's continual worry, jittery, agitated, and sleep deprived. Okay, it's like a free-floating kind of anxiety where the person has it without any explanation of what is the trigger for this anxiety. And it's horrible. If you can imagine yourself being in a state where somebody has jumped around a corner and scared you, and you get that all of that sympathetic nervous response where your stomach turns and you sweat profusely and you feel horrible. You can imagine somebody that has to live with that for a long time. It is not a nice situation. The panic disorder I described before with the panic attacks. These are people that have them on a regular basis. Again, there's no trigger, and often they will start to avoid situations where they feel like they may have a panic attack. So if you have a panic attack at school, for example, you may start to avoid school because you are very embarrassed and don't want to have another panic attack that you've gone through. They are horrible episodes. And again, the phobias, right? Specific phobias are different things. If you look up on the internet, you can see we have so many phobias that have been named. Some of them are quite entertaining names. In fact, look up the fear of long words, what is called as a phobia. But you can basically develop a phobia to anything. And we'll talk about the causes of it coming up. Social anxiety disorder is a disorder where we are afraid to be around people. Okay, we're afraid to be in situations because we feel people are judging us and we feel that we don't measure up. Agoraphobia often is caused actually from panic disorder. It's where people won't leave their house or leave their apartments because they're afraid. Translated, I believe in Latin, it means something along the lines of fear of open spaces. But it's really, when we look at it, it's more of a fear of panic attacks because we avoid all those situations. And obviously those people need to be cared for a great deal. Here's just a chart of some common and specified fears. You'll notice many of the fears around the world are the same. Height leading the one. And it makes sense, evolutionary-wise, to be afraid of height. Those people that weren't afraid of heights and walked off the edges of cliffs probably didn't pass on their genetics. Okay, so it makes sense. But when we look at fear compared to phobia, there's a big difference. It's, like many of us are afraid of the dark, for example, or we're afraid of animals, snakes and spiders, or being alone. But it doesn't interfere with our life to the point of it being a phobia. And that's the difference, really, of it becoming a disorder as opposed to just a normal fear. So, again, obsessive compulsive and related disorders is a new section in the DSM-5 compared to the DSM-4. If you look up information on the internet, you may see DSM-4 related information that says obsessive compulsive disorder is a anxiety disorder. But this is included with 3 other disorders: body dysmorphic disorders, which when you look in a mirror, you see small flaws as being large flaws. or there may not even be a flaw at all. Some of you may have heard about, the anorexic people that are skin and bones. Look and see a fold of skin as being a roll of fat. It goes along. That's what body dysmorphic disorder is. Hoarding disorder, popularized on TV, obviously, where people just hoard things. They attach sentimental value or emotional value to objects or garbage, and it overruns their lives. Very serious. Trichotillomania is people that will pull out their hair, and it's usually a response to anxiety. No, I don't have it. I just shave my head. But no disrespect to those people that do have the disorder. Trichotillomania is one of those ones it's bizarre to a lot of people. Okay, so these are the obsessive compulsive and related disorders. But the OCD has a two-component thing. It's an obsession versus a compulsion. The obsession is a thought in your head that you can't get out. It just recurs. The compulsion is what you do to relieve the anxiety caused by that thought. Okay, so for example, people may have obsessions with germs. So their compulsive behavior is to wash their hands on a regular basis. And this isn't like, 3 or 4 times a day. It can be to the point where their hands bleed. We have checkers and hand washers, people that need to check and make sure everything is just right. Did I hang up my clothes exactly the way I'm supposed to? As opposed to hand washers that will do that behavior like I'm to the point where they actually will make their hand bleed. These are the most common obsessions and compulsions, and you can see that the germaphobes, the people afraid of dirt and germs and toxins, is the vast majority of people with OCD, about 40%. Okay, something terrible happening, fire, death, and illness, 24, symmetry, order, and exactness, 17. And some of these people need to have like every can in their house alphabetically arranged, sitting in a perfect way where the labels are facing out. You've all heard the stories of people that have this disorder. The compulsions, again, we have excessive hand washing or cleaning. It can be repeating rituals, in and out of a door, up, down from a chair. Maybe you have to do it, 6 times every time. The other one, checking doors, locks, appliances, car brakes, and homework, is another compulsion that we see quite often. Now, all of you have probably experienced where you're not sure if you set your alarm properly, so you get up and you check it, and then you go back to bed and you go, oh, did I go, is that AM, PM? You go back to bed and you go, oh my gosh, did I turn it off when I checked that? Well, that's kind of the idea of the obsessive compulsive person, only theirs doesn't go away, and it's not a normal thing, and it's on a regular basis, and it interferes with their lives. The trauma and stressor-related disorders, PTSD, which used to be in the anxiety category, has its own. So it's things that were brought on by environmental stress, like PTSD. So PTSD, the symptoms include haunting memories, nightmares, social withdrawal, jumpy anxiety, and sleep problems. It's become quite common that we hear about this now because we're getting a new awareness of post-traumatic stress disorder. It's not a new thing. We used to call this shell shock or battle fatigue back in World War I and II. People would come back and they wouldn't be the same. However, now we recognize the set of symptoms that happen, so we look at it. We've also figured it's not always people that go to war. It can be people that just have some kind of, severe stress that happens. And we have found, that not everybody succumbs to post-traumatic stress disorder. But however, we're looking in, like first responders. We're finding more PTSD in first responders, and now we're aware and are able to help them. And of course, there's been many highly publicized, top military people that have taken their lives because of the PTSD. We also find that the closer you are to that traumatic event, the more likely you are to get it. We're only looking at, about 10% of men and 20% of women that develop this. But when we look at what happened in New York in 2001 when the World Trade Center was knocked down, those inside the building were 4 times more likely to develop post-traumatic stress disorder, the survivors, than those that were witnessing. So the closer you are to it seems, the more it's going to trigger PTSD in somebody. Now, a lot of people that have come through a lot of situations, Holocaust survivors, people that have been through situations, would go, how do you not have PTSD? They'll link it to the idea of post-traumatic growth, where when you've had adversity and you rise above it, it actually makes you a stronger person. And so we do see that a lot. We see it a lot in, people who have successfully battled cancer, and they come out and they say they have just a new outlook on life and they see things in a different light. And sometimes people will thrive after they've gone through adversity. The other trauma and stress related disorders, we have a reactive attachment disorder. I'm not going to explain them all, it'll take too long. Disinhibited social engagement disorder, post traumatic stress disorder, acute stress disorder, and adjustment disorders. Now, post traumatic stress disorder, for the first time in the DSM 5, has been given a children's diagnosis as well. Before, you had to be a certain age. You could not be a child. You could not be diagnosed with PTSD under the DSM 4. So what causes all these things? And we look at different perspectives. There's the learning perspective where we have classical and operant conditioning. Stimulus, generalization, and reinforcement. So if you remember, this could be something along the lines, we develop a phobia because we are eating a bowl of peaches when we are 5, and something horrible happens in front of us that may involve a horrible death of a loved one or parent. We associate that situation with that, what did I say, pear, peach, whatever it was. And then from then on, we have a fear of those and we develop a phobia to that fruit. So it can be anything that we develop to with this kind of idea. It can also be observational learning. We look at monkeys in the wild are afraid of snakes. Now, we had some monkeys in a zoo that were not afraid of snakes. They introduced a snake. It was not a problem for them. They were not afraid. However, they brought in one monkey from the wild. The monkey came in and it showed that it was afraid of the snake. So then all of the monkeys became afraid of the snake. It's almost like if I see that person afraid, I should be afraid. This might explain, sometimes we see little kids will play with bugs and then a parent comes out and freaks out over it. Now all of a sudden that child is afraid of the bugs. So it can be through learning. The biological perspective says it's natural selections. Okay, or it can be natural selection. In the past, it was a good idea to be afraid of spiders and snakes as they could kill you. Those that weren't afraid didn't pass on their genetics, and so on. And we do see this in more modern research where we look at monkeys that have come from high-strung families, high-strung parents, tend to develop fears more easily than the monkeys that didn't. So there is an idea of genes, how we are brought up about. We're trying to isolate genes that show anxiety. We think there might be one kind of anxiety gene that seems to affect our serotonin levels, which controls our arousal and our sleep patterns and all those types of things. And also glutamate seems to be an active ingredient when it is to cause anxiety and stress. And we look in the brain at people, the anterior cingulate, if you can see in the diagram, is right there. And we see it is a lot more active in people that have developed OCD and are having difficulty with anxiety. We seem to have more active limbic systems in those, and the anterior cingulate helps discern what we should be paying attention to and keeping everything in check as far as how we respond to things as far as our temperament goes. So that's our video on abnormal psychology. We'll be back very soon. We'll see you folks in class. Bye for now.